Good morning, everybody. Happy Monday. Happy New Year. It's good to be back. Missed you, Krystal.
Indeed it is.
Yeah.
And indeed we have a wonderful show for you today. Lots, of course, to catch up on. We have for you the very latest on Omicron, what we know about it, the seriousness of it, government response to it, all of that good stuff. Also, Twitter banning permanently Marjorie Taylor Greene. We will tell you why and what we think about it. You probably won't be surprised to learn what we think about that.
That's right.
New data from our friend Matt Stoller about exactly some of the causes of inflation that you're not hearing a lot about in the mainstream media. Also, some good news going into the new year. There are record numbers of states and localities that are upping the minimum wage thanks to a referendum that their voters passed. So that is exciting news as well. Also, the less than satisfying conclusion to the Ghislaine Maxwell trial and some developments there, including some very, very interesting media choices.
Yes.
BBC.
Guest choices.
Looking at you with Alan Dershowitz. We got two Starbucks workers on to preview for us what could very well turn out to be the year of the worker. That is something hopeful. That's
what we're hoping. We're going to push it. It's going to start here.
That's right. We're declaring it right here, right now. But we did want to start, Saagar, with the very latest with regards to Omicron.
Yeah, that's right. I mean, obviously, everybody you know, probably I know as well, you know at least somebody who contacted Omicron. Everybody I know seems to be doing fine. My mom got it. She actually is okay, so glad to hear that as well. But there's been some troubling questions around treatment options and more. As we have seen, you know, the discussion around monoclonal antibodies is very, very effective against Delta. The data around it is actually a bit mixed, although still hopeful in the right direction. Obviously, booster as well as vaccination amongst people who are elderly, obese, and in general seems to dramatically reduce hospitalization and death. Those are all good things. The discussion, though, around some of the life-saving COVID treatments in the city of New York has taken a very dramatic and really, frankly, terrible turn. And we wanted to make sure that we dug into it as much as possible because this is causing a lot of consternation and, you know, rightfully so when we get to the bottom of it. Let's put it up there on the screen. So New York City will be considering race when distributing life-saving COVID treatments. So what they mean by that is that they will take into account a patient's race when distributing potentially life-saving COVID treatments, according to the Department of Health and Mental Hygiene website. The city, this is from their official guidance, quote, will consider race and ethnicity when assessing individual risk from December 20th, which adds that long-standing systemic health and social inequities can contribute to an increased risk of dying from COVID-19. This specifically is targeted towards monoclonal antibody treatments. This was another policy that we saw down in the state of Texas, and it continues to bubble up as we have shortages. Whether those shortages are supply side, demand side, or whatever also remains very much up for debate. But we have to highlight this, Krystal, and say that just as terrible as it is to discriminate healthcare based upon vaccination status, the same is to be said for race. And also, you can assess all of this without even having to take race into account, and it would probably still have the same effect. If you are, you know, obese or have diabetes, you may be more likely, in order to belong to a specific racial category, just use obesity status, diabetes status, and immunocompromised status. You don't have to add race on top of that. It's the worst fears of a lot of people in terms of the way that healthcare and identity politics would become meshed, you know, including this babble speak, when medically it's not even necessary.
I mean, this is woke racism.
Yeah, it's nuts.
That's what this boils down to. And listen, so there are certain conditions where your race could be actually correlated. So sickle cell anemia.
I was about to say sickle cell is the classic example.
That is not the case with coronavirus, okay? I mean, listen, it's possible, but there has not been any research or data to indicate that COVID impacts people differently depending on their race. So even if you're using race as a proxy for something like socioeconomic status, and by the way, Glenn Greenwald had a great post breaking all of this down, that in and of itself is kind of racist. If you're basically saying like, well, we're gonna say if you're black, we're just gonna assume that you're poor.
Yeah, it was like, wait,
what?
Yeah.
That's not okay to do. Because yes, if you look at socioeconomic status, that is correlated with a lot of the risk factors, including the types of work that you're likely to do, which is likely to put you in contact with the public where you're not able to sequester and work from home like white collar professionals have been able to. That's one thing. Another thing, socioeconomic status is correlated with obesity, with diabetes, with some of these conditions that put you at heightened risk. But to boil it down to just race, it's the opposite of being backed by the science. So again, there are some conditions where this would make sense. Coronavirus isn't one of them. So this is one of those things where on the one hand, you look at it and you're like, we don't actually know if any white people who have been denied treatment because of their race, maybe this is just a one-off, maybe it ultimately isn't a big deal. But it's emblematic of a very troubling direction and mindset that seems like less of a one-off and more of a trend, which is why we chose to highlight it here.
Absolutely. You guys will have to remember in the very beginning of vaccination, so about a year ago, there was a big debate that we saw amongst public health ethicists because some people, like me, normal folks, wanted to vaccinate elderly folks first. But many public health ethicists said that, well, old people in America are disproportionately more likely to be white, so that would be systemically racist. And it's like, well, hold on a second. Once again, it's not to do with race. If you're old, you are dramatically more likely to die. From there, we'll go down to obesity and immunocompromise. And then you can go down to health. Health is variably and widely distributed across all races, and you have a lot more in common as an obese black Hispanic person with an obese white person than vice versa. And same whenever you're healthy across all different racial categories whenever it comes to your health. It's actually one of the stupidest ways from people I've spoken to in order to try and classify the way that we should be targeting COVID health. So it is a horrific, terrible direction that the U.S. healthcare system can go towards, and that is something which, if we're going to see this get implemented, and once again, in terms of these shortages, there's a lot of questions about why exactly we even have a monoclonal antibody shortage, but that's kind of a discussion for another day. The real question here is if we're going to have scarcity of tests, of treatments, and more, the way then that gets distributed should always be towards the people who are most vulnerable. Those who are old, those who are immunocompromised, and those who are obese. It's not complicated. I can't understand this.
There's also a tension between the liberal view, which at times has been, you know what, if you're not vaccinated, you shouldn't even get treatment. You should be put at the back of the line.
It's like a libertarian dream.
Okay, so that's one view. And then this view, which says if you are non-white, you should be prioritized, because it ignores the fact that for most of the pandemic, the post-vaccination pandemic, Black people and Hispanic people were less likely to get vaccinated, largely because of justifiable, terrible past experiences and present experiences with our healthcare system. That's very inconvenient. So one of the reasons why you might say that Black people have been disproportionately impacted by COVID is because they've also been less likely to get vaccinated. Again, that sits uneasily with this other view over here that if you're unvaccinated, you basically, deserve what you get. So again, it doesn't make sense. It's the opposite of following the science, and it ultimately boils down to just like the flip side of the most abhorrent sort of white nationalist views.
That's right.
It's like the flip side of that, of let's discriminate based on your race, just in a different direction, and so that makes it ultimately okay.
Yeah, well, let's go into the deeper, just exactly how it's going with Omicron. I know that's what a lot of people wonder. So we have the charts of hospitalization and deaths side by side. Let's put that up there on the screen. There you can see the newly reported deaths by day. Now look, obviously there has been an increase because of Omicron. However, it is not even close to the highs that we saw in Delta, despite the fact that if you'll take a look there on the right side at hospitalizations, we see the same thing. The hospitalization and deaths were much higher during the Delta variant as opposed to Omicron, indicating some less severity. So that is actually a very good thing. There also comes down to the federal response. There was a lot of consternation, Krystal, over the holiday when the president spoke with all of the states' governors and said that a solution to COVID will come from the states, not from the federal government. Kind of happened to agree with him on that, but let's take a listen to what he said first.
Look, there is no federal solution. This gets solved at a state level.
It was interesting to me, a lot of right-wingers were very upset, obviously because Biden, said the federal solution to COVID, all of that. But look, this is kind of what we wanted from the beginning. We kind of did want an admission that there is really no quote-unquote end game here, except for learning how to live with what we have, beefing up testing capacity and the ability for all of us to live our normal lives. That being said, seemed hypocritical, but also it's also an abdication of responsibility on some of the stuff that you can do.
Yeah,
and that's
right.
the problem.
So my view on COVID policy is that because we have different parts of the country that are very different culturally and have very different sort of risk assessments and tolerance, that it does make sense to have local responses.
Absolutely.
Okay, so in that way, I agree with him. But to the abdication of responsibility point, we damn well need a federal solution for the lack of tests or the lack of sufficient amounts of monoclonal antibodies so that people can get the very best treatment if they do end up hospitalized. We damn well need a federal response in terms of lifting the patent protection so that people around the globe can also get vaccinated so we don't continue to have these new variants emerging that pose new and novel risks to our own population. We could certainly use, now they're saying, now that we're allowed to admit that cloth masks, that there's a difference between levels of masking.
Don't you love, we could have been removed from the internet, 3 months ago for saying that explicitly.
That's fine. If different masks, this is something, again, there's been science to back up for a while now, distribute good masks to everybody. Those are things that the federal government, you could use the Defense Production Act, you could make it a national, wartime type effort. The fact that we don't have sufficient tests is such a disgrace. I personally visited or called a dozen or more different Walmart, CVS, everything in my little region in King George County in Fredericksburg, Virginia. Impossible to get a rapid test. So, this is unique to America. Plenty of other countries around the world, including places that are a lot less wealthy than we are, have managed to have rapid tests available for their population, and yet we have completely failed. So yes, on the one hand, local control and, gauging risk tolerance for the population locally, yes, leave that to states, counties, cities, et cetera. But there is a lot that the federal government should have been doing and has utterly failed to do. And of course, this is very, very different from what Biden sold when he was running for president. We were all going to get back to normal.
I would put it this way. The feds have to make it so that they provide the backbone and the infrastructure for then everybody then to be able to make their choice. So if people, like you said, the masks, whatever, personally I'm against it, but some people want it. That being said, it's up to the locals. They get to decide on how they would then be able to, now knowing that they're going to have enough tests, enough masks. But on the testing front, because we don't have enough tests, a lot of schools are with, much more recalcitrant populations and parents who are freaked out. They're just going virtual. They don't even have enough tests in order to test all the students. So what are you going to do? Testing was, and I don't think this should be the case, but it still could be the case. It would be a way in order to assuage the most, freaked out people and say, hey, look, everybody's been tested. When you have a wide availability of tests, as they do in Europe and many other parts of the globe, then, a lot of life is much easier in order to go back to normal. And that's just a way in order to ease things out to an area where people can learn to be more comfortable and live with the virus. And that's just something where, while, yes, it is good, and my monologue will be on this, that CDC and Fauci and all of them are basically admitting, that a lot of these guidelines have nothing to do with science and have more to do with what they think public opinion can gauge, that doesn't mean, though, that people aren't still really freaked out. And the media has a big role to play in this. Nate Silver tweeted this. Let's put this up there on the screen, which is that the New York Times ran a story saying, headline, Puerto Rico faces staggering COVID case explosion. And yet, only in the 13th paragraph, do you learn that only 300 people are hospitalized with COVID on an island of 3 million. Exceptionally good news and testament to the power of the vaccine whenever it comes to preventing hospitalization and death. It's just they don't know how to report something without fear-mongering. I see it every day here in Washington. Oh my God, we have the highest case rate ever. What are the hospitalizations and deaths? Oh, less than Delta? Okay, so why should I care? It's across the whole country. And, the more we look at it in terms of Omicron, South Africa, where we saw the first widespread Omicron burst, put this up there on the screen. Their government now says that the country has passed its peak without a major spike in deaths, offering cautious hope to other countries that are grappling with the variant. So from the beginning, we owe a lot to South Africa. I really do want to say it's terrible what happened to them in terms of the travel ban. Omicron didn't even originate from there. They have a very good identification program early. They warned the entire globe, and they've been giving us consistently good data and news, and our media is the one that has been distorting it for our audience. The truth is, Omicron is much less severe, obviously, in terms of hospitalization and death. You could see it in the data right in front of your eyes. Even with kids and more that are infected, Dr. Fauci, as I'll be saying in my monologue, is now even saying, don't worry, it's not kids dying from COVID, it's kids dying with COVID. That's been the case for a long time, but Omicron has now made it so that we can all just admit it, and especially with the less hospitalizations, the severity and the death and all of that, it's changed the game. I mean, it really is just kind of a very virulent type of the flu with the vaccination. That's the
with
very
vaccination,
key.
that's very true. And so one of the stats that's been out there, which is true, is that there are more kids hospitalized now than because of Delta. The reason for that is because fewer kids are vaccinated. And this has spread. It's incredibly contagious, as I'm sure you are experiencing in your own lives. There can't possibly be a single person in America who doesn't have someone
in their close circle
who's had an encounter at this point with Omicron. So the vaccination status really, really important. Even Dr. Fauci is saying that they think that this is going to peak really quickly and begin to fall really quickly. That was what we have seen now in South Africa, which is really hopeful. The other thing that is also hopeful is, number one, for a long time, people were not saying with confidence that it's less severe. Now everyone is basically saying with confidence it's less severe. We see from data in the UK, it reduces, compared to Delta, Omicron is 50% less likely to send you to the hospital. Great news. And ultimately, because it is so infectious and because it's less severe, it may actually give us kind of a way out of the pandemic because everyone will have some form of immunity. Now, listen, this is not, a great thing to cheer for. And again, I really recommend, if you're not vaccinated, that you get vaccinated because then your risk is so much even less with Omicron. But the other thing that research is starting to show is that Omicron immunity does provide you with pretty good resistance to Delta.
There you go.
It's actually not the other way around. So if you've had Delta, it doesn't appear that you have great resistance to Omicron. You're still very likely to get a breakthrough infection. But Omicron seems to provide pretty good protection against other variants that are out there, which again is really encouraging. So listen, guys, it's, I know, a really chaotic time. The fact that it is so infectious means you are going to have a spike in hospitalizations and you will have some increase in deaths. That's already happening. That's inevitable. But much less severe than Delta, and ultimately, hopefully, we'll get through it quickly. And I just pray that it doesn't, disrupt. The thing that I worry the most about is schools, because since it does spread so rapidly, I can see how school districts just literally don't have teachers, sufficient teachers to have in the schools. But I would just really encourage, you to push to keep the schools open if it is at all possible, because we know for sure how damaging school shutdowns were for kids. And we know that this is mild and a low risk for children ultimately.
I saw a good take. I forget who exactly it was, but in other countries, the last thing they shut down is the school. Here, the first thing that gets shut down is the school. All the universities here in Washington, D.C. are remote, even though they have booster mandates. It's the most ridiculous thing I've ever heard. And look, they're college kids, but they're suffering. I mean, I've heard from a lot of them, they're paying, top dollar in order to sit at home in their parents' house and do Zoom school. You could say, oh, those idiots, student. Look, it's a sunk cost at a certain point, too. You're already within the system. So you got to feel for not just them. I mean, every young person out there who's having their life hobbled by this. It's not a way to live. And we shouldn't live this way. There's nothing to indicate that. There's a lot of people who don't, and they're doing just fine.
Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.